Welcome back. Some German passengers stranded on the AIDAmira cruise ship have returned home after testing negative for COVID-19. They were quarantined at the Cape Town harbour after a crew member showed symptoms of the virus. Now, Germany is donating a further 36 million rand to fight COVID-19 in South Africa. Martin Schaefer, German ambassador to South Africa, joins us now via Skype from Pretoria. Ambassador, thanks for your time. We appreciate it. So first, let's talk about this. Germany was supposed to send a team in to evacuate Germans from that cruise ship. Is that still happening?
Good afternoon, and hello to everybody who is listening or watching us now. Well, I think from what I know, I do have to correct your introduction just a little bit. On that cruise ship, the AIDAmira, we had a couple of suspicious cases, 6 to be exact, and all of them were transferred at the end of last week to the Groote hospital to put them in proper conditions and to test them on the coronavirus. All 6 of them tested negative, and that was the trigger and the reason, and that gave the possibility to South Africa to let all the other passengers of that cruise ship, all in all about 1,250, more than 1,000 people were Germans, to disembark over the weekend and to leave South Africa via Germany to Germany on evacuation flights operated by Lufthansa. And as we speak now, I can safely say the last passenger from that ship not only has left South Africa, but they have arrived safely home. And I think this is a wonderful example of international solidarity and a wonderful example of cooperation in, how should I say, in times of cholera, in times of corona.
Yeah.
Because we did have, different interests. It was my job, together with my colleagues, to get this looming humanitarian catastrophe on a ship that is far away from home waters, to get that done and to get my Germans safely home. At the same time, South Africa has a very legitimate interest to make sure that nobody leaves as far as possible the coronavirus here while they leave. And we had very constructive talks. We had very engaged commitments by the South African government and indeed by the ship managers and by ourselves. And the deal, and the compromise we found was optimal because it safeguards all the interests of everybody involved.
I'm glad you guys are cooperating in that regard. But let's talk about further cooperations in terms of you donating millions to South Africa to help with COVID-19. Do you know how that money is going to be used?
Oh, yes, of course. And I'm happy to share that with you. On Friday, the 2 foreign ministers met virtually by video conference in their binational commission. And one of the outcomes of that binational commission, which is, if you want, the meeting amongst both governments to draft a plan for the cooperation in the next 2 years, was that in a first step, we are going to dedicate 38 million rands to the South African government's efforts to contain the spread of the virus. And we agreed, and we thought the most important thing that South Africa needs now is, first of all, test kits to make sure that South Africa knows where we stand with the spread of the virus. And second of all, equipment for hospitals to brace for a situation where the hospital system, private and public, would need to cope with a huge demand of patients who need ventilators and others. And so we agreed on a process where our development bank, the KfW, would engage with the Department of Health to make sure that we go out to those that can deliver those products, and that we bring as fast as possible, by leaving aside all the bureaucracies involved, the necessary test kits, to purchase them and to bring them into South Africa. And that process is ongoing as we speak, and I think it won't last long until we have the test kits in South Africa to help the South African government curb the spread of the virus.
So Germany has over 26,000 cases and over 100 deaths. Any lessons you think South Africa can learn from how your home country is handling the situation?
I think there's a lot that we can learn from South Africa. First of all, I believe that South Africa and the decisions the president took on the 15th of March were way ahead of the curve It was a moment when there was only the first internal communicated infection in South Africa, only 61 cases, if I remember well. And the South African president took quite drastic measures to bring down the people-to-people contacts in your country. And there's a lot of measures that were put in place that we also have put in place, but at a later stage when the virus had already spread further into the population. Now, in Germany, if there's anything, I think that is might be a little bit better than in other countries. It is the fact that we have a number of deaths that is comparatively low by comparison to the confirmed cases. And I think it has to do with the fact that there's ample testing in Germany. So we have a larger base of people that we know the status of, first of all. And second of all, we do have a hospital system that I think is coping well, because we do have a number of ventilators, we have a number of intensive care unit beds that is probably a little bit larger than in some other countries, which means that it will take longer in Germany until the health system is overwhelmed. And what lessons to be drawn from that? I think test kits, test the people that are suspicious of having caught the virus, to know where we stand and to give the health authorities the opportunity to take the right decisions. And second of all, brace yourselves in the health institutions. Make sure that the ventilators are there, that the intensive care units are there to care for the people that need our help.
Thank you so much for your time and your insight. Martin Schäfer, German ambassador to South Africa.